So as far as first aid kits go, here's my first aid kit. You may notice it looks like a bag. That's because it is. I may have a little bit bigger kit on me, but generally this is what I have on me at all times. Either it's in the trunk of my car or it's slinged to my back. It's got one strap, got my little CPR face mask on there, got my opioid overdose prevention kit, which, by the way, this thing's worth its weight in gold, but it is free, and I will put a link in the description to show you where you can get that in case you haven't seen the previous content where I've explained where to do that. Moving on. The first thing that I have accessible in my first aid kit, first thing I do when I pop it open, is I get access to this. This is a bleed kit. I got this one from Recon Medical for about 20 bucks back before there was a war in Ukraine that made all medical supplies extremely expensive. If you've got the time and the money to prepare properly, do it. If you're too poor, or you miss the sale and you're too poor, here's some suggestions. First off, this is the chest seal. Chest seals are great for any kind of puncture wound in an area where the lungs are, so that's pretty much anywhere above the diaphragm. If you do not have a chest seal and you notice that someone may or may not be about to die because they have a sucking chest wound, an easy way to fix that is take a plastic baggie or a piece of foil, or perhaps the wrapping from your chest seal, because this is foil, and you place it over the wound and then you tape it on 3 sides. Now when you tape it on the 3 sides, you leave one side open. What this will do is create a one-way valve, just like a chest seal, that will allow air to go out but not to go in. Every time you breathe in, it will suck the either the foil or the plastic to the wound, occluding the hole, allowing your patient to live a little longer, hopefully. And I think they run for about 10 to 20 bucks right now. They used to be a little bit cheaper, but again, Ukraine. All right, so the next thing that would be inside of any bleed kit is going to be a tourniquet. Now, this is something that you don't want to skimp on. And in fact, while it is possible to improvise a tourniquet, they don't work very well when you improvise them. This one was like 20 bucks. Now, they're about the same, honestly. You want to get a good brand, something like that's TCC certified. There are other kinds of tourniquets. I don't know anything about them. If you like them, let me know, tell me why, and I'll argue with you. The one thing I do like about this kind of tourniquet that's got the bar on it is you can put it on yourself. So if you happen to get cut on your arm or on your leg and you are about to bleed out and die, you can put this on by yourself, and you don't need the limb that is damaged to attach it, which is good. This is Z-fold gauze. This is a good thing if you've got a wound that you feel like you can kind of stuff into it to kind of help stop the bleeding. If you're very lucky, you can get special gauze that has hemostatic agents in it, which will help your blood. Is a rescue blanket. So this is a Mylar safety blanket, and what this does is, well, as you might imagine, someone who is in the process of losing all their blood to the earth is probably going to be getting cold. And this is bad for 2 things. 1, it's chilly. 2, when you get too cold, your blood stops clotting the way it's supposed to. So keeping someone who has had a massive, who is having a massive hemorrhage, keeping them warm is very important, because if they get too cold, they will bleed faster. So here's a blanket. And set of shears. This is something you can skimp on. They're fucking scissors. You want to have a Sharpie because you can write on things that may or may not be dirty, like someone's face, or most likely you're going to write the time that you place a tourniquet on your patient, so that they know when they get to the hospital or wherever how long that tourniquet has been on. If they are conscious, try and get as much information about your patients as possible, and the easiest way to do that is to take notes. This is useful for other things, such as groceries, or writing love poems to people who may or may not requite your love. I'm not lonely, I swear. Do not hand out medication to other people. That will get you in serious shit. But if you only give it to yourself, having medicine, especially medicine that you use on a regular basis, in your individual first aid kit is a great idea, especially if you have medication for stuff that is life-threatening. Things like asthma. You should have your inhaler on you at all times. For the love of God, have your inhaler on you. Please. Also, if you're allergic to things, especially things that are very common, things like bees or shellfish or peanut butter, or people looking at you the wrong way, maybe you should have your EpiPen on you. Now, let's see. Vaseline. I'm not lonely, I swear. But you know what the Vaseline is great for is pretty much any kind of wound, you can put Vaseline on it. Oh, the most important thing. I've got gloves. And because I'm a giant nerd, I actually keep my gloves in my pocket. I keep a lot of gloves in my pocket. Because you would think one pair is enough, but you are often wrong. Especially if you're dealing with someone who is very messy or very bloody or covered in various other bodily fluids, you're going to want a second pair or a third or a fourth or a fifth. So get in the habit of carrying gloves on you. You'd be surprised how often it comes in handy in a non-first aid situation and not on a Saturday night. Hey, what's that? Is that an inhaler? I don't even have asthma. They're very fancy bags that are almost always designed to be on a plate carrier of some kind. That means that they have either Molly or Alice clips or some very fancy military style attachment that most people, first of all, don't like the look of. Second of all, don't have the utility or the opportunity to use these mechanisms. Just get a fucking bag. Just get a bag that is a fairly decent size. A fanny pack will work. Gen Z is all over this right now. They love their fanny packs.